when you look at it, what can we do about this serious medical disorder? I mean, it causes all the problems we saw earlier. It causes marital discord, automobile wrecks, all the things that we see. People who have obstructive sleep apnea utilize the healthcare system to twice the financial amount annually. All these problems, and what are our solutions? Well, the most common one is CPAP. It stands for continuous positive airway pressure. And that's been kind of the gold standard, as they say, of treatment. And it basically is a pump that pumps air into the airway. And then dental devices or dental appliances or oral appliances. By the way, we call them dental devices. You can call them oral appliances, mandibular advancement devices, orthotics, in other words. But all these are still just pieces of acrylic that we put in the mouth to dilate the airway. Those are really the top two categories, and we're right there, and there's not enough dentists out there that know how to do this. Other categories there's some surgeries, and certainly weight loss will help most people. It doesn't always cure people, depending on other factors. Anybody out there who snores and their husband or wife, when they snore, what do? Give them the old nudge with the elbow. What do? You roll over. Well, that's positional therapy is what that is. You lay on your side. Oftentimes your apnea is worse. Is better than it is on the supine or back position. And I think really what's underutilized a lot is hybrid therapy. Rich does a lot of this. I'm doing more and more of it. But that's a combination of CPAP and dental device. I think that's extremely important for us to get involved in the future.
Yeah, and we'll talk just a little bit more about that. When you look at CPAP masks, though, and what's there, I don't know. If you're 32 years old and single, you're probably not wanting to put that on every night. But I don't know. Who's this guy on the lower left? Is that Dr. Evil there? I can't figure out.
I thought it was you, Rich.
I thought it was me. I got a little more hair than that.
Something you said, we kid a little bit about CPAP in the slides a little bit to show that it is a cumbersome thing. I even got a slide that I don't have in here where it's got a person laying in a bed and a glass of wine, and it's basically trying to make CPAP look appealing. And we can't really make it look appealing. That being said, it's a wonderful life-saving device for many, many people. But the bottom line is a lot of people, they won't wear it. Even the people who enjoy it, like the single people you talk about, I've made many, many, many dental devices for single people who don't mind their CPAP, but they don't want it to be the first thing that they're experiencing with any type of a new relationship.
And let's not forget about traveling. A big part of my practice the last few years has been elderly people who are really tired of lugging their CPAP around. They have to, what they have to do to go through the airport. So it's important that we help our patients find a treatment option that works for them. And if it's CPAP is working, that we encourage them to wear that. But we can certainly add to that. And one of the things we can do through a type of hybrid therapy is to combine a dental device with a custom-made mask or something like that. And there's a couple of reasons we might do that. One, the CPAP pressures, as they get higher and higher, the mask has to be tighter and tighter. Just the mask pressure on the bridge of the nose or the maxilla can actually start to move bone around and move teeth around. Nobody wants to talk about the side effects and the caveats of CPAP, but it has plenty of them. When we put a dental device in there and we move the jaw forward a little bit, we can significantly lower the pressure of that and make the therapy much more successful either way. So besides doing CPAP, we can look at surgery. We basically just start cutting things out. This slide came from a good friend of mine, Dr. Ken Moore. And Ken, put some of these things down, and what are we doing here? We're basically just finding something and we cut it out, don't we?
Well, most procedures remove tissue, trying to make the airway open more that way. Other ones try to make the airway stiffer, like maybe the not all too effective pillar procedures or some other scarring type things, and then or else move the bones. I mean, I think they all fall into one of those categories, don't they? Removing something or moving the anatomical structures or trying to make things stiffer.
Let's not forget about the tracheostomy too.
Yeah.
We just bypass the airway and we cut a hole in your throat and put a straw in it and put a filter on it, and you get to breathe through that.
I met a guy on a plane last week who had a tracheostomy for this. I saw his scar. He sat beside me on the plane, and he had that. He was thrilled with it for a long time until he finally got used to the CPAP. It saved his life. So, I mean, I do mention that to my patients. I really do say that, this is a treatment option because it really hammers home the thought that we show them on that anatomical slide, the thought of where the obstruction actually occurs. One thing I didn't want to interrupt you earlier when you were talking about the convenience of an appliance versus CPAP and flying. I have sleep disordered breathing myself. I can snore to wake up people three rooms down the hall, and I do a lot of flying with lecturing and so forth. And you know what? You can't plug a CPAP in the plane, but I can put my device in when I take a red eye home and not disrupt 5 rows either side of me. It's a huge benefit. I put it in every time I fly.
Good point. I did see a patient the other day too. I said, "Why are you here?" And he said he put his hands around my throat like he was choking me, and he said, "This is how I woke up on a plane the other day." This lady had her hands around my throat, and she was shaking me, saying, "If you don't quit snoring," and everybody on the plane was clapping. So